What is a normal oxygen desaturation index, ODI, for children? Have you ever wondered what the oxygen desaturation index means for children? This measure is essential in understanding how well kids breathe during sleep. It tells us how often a child's blood oxygen level drops during the night. This is especially important when looking for sleep disorders like sleep apnea. For children, determining a normal oxygen desaturation index can be a bit tricky. Kids have different bodies and sleep patterns compared to adults. The American Academy of Sleep Medicine suggests using a 3% oxygen desaturation threshold. This means we look for drops of 3% or more from the child's usual oxygen saturation level during sleep. Research shows that in healthy children under 12 years old, the normal values for the 3% oxygen desaturation index are generally low. However, we are still figuring out the exact reference ranges because there is limited data available. One study found that the median oxygen desaturation index for children was around 6.4 events per hour. Many children experience mild drops in oxygen levels but do not reach dangerously low levels. When it comes to oxygen saturation during sleep, healthy children typically maintain levels around 96 to 97%. An oxygen desaturation index of fewer than about 5 events per hour is often seen as normal for children, although some variation can occur. If the values are significantly higher, it may suggest breathing problems during sleep, such as obstructive sleep apnea. It is important to note that drops in oxygen saturation below 90% during sleep are usually considered abnormal. These cases often requiring further investigation. Severe drops below 80% are rare in healthy children and usually indicate serious issues with breathing during sleep. Monitoring the oxygen desaturation index in children is vital. Repeated drops in oxygen levels can impact heart health, brain function, and overall growth. Sleep studies, also known as polysomnography, that include this measurement help doctors understand the severity of sleep apnea and make informed treatment decisions. While we are still refining what normal oxygen desaturation index values are for children, an index under approximately 5 events per hour, with oxygen saturation mostly above 95%, is generally accepted as normal. Higher values may signal the need for medical attention due to potential sleep apnea or other breathing issues.